I started donating breast milk with my first child when she was a baby. When I first learned of the opportunity, I wanted to donate extra breast milk because I wanted to give back. I wanted to contribute to help others. I also wanted to teach my children about giving back. They each know that they shared their milk when they were babies.
Allie was born at 26 weeks and 1 day. She came out early. She weighed 1 pound, 14 ounces, and was about 12.5 inches long. We were in the NICU for 3 months. I wasn't able to produce enough breast milk, and so we ended up using the donor milk bank program. It actually wasn't a thought in my mind that we would actually be using the milk bank until she came early. And the nurse actually gave us the form and talked to us about it and said, I know this wasn't necessarily what you wanted to do, but this is a really good option for her. If it's not your breast milk to still get breast milk and get those nutrients, that formula wouldn't necessarily provide her.
I'm Dr. Nancy Fahim. I'm a neonatologist. That means I'm a doctor that specializes in working with newborn infants, mainly babies that are born early or premature, or babies that have a difficulty in transitioning and require some support in the intensive care unit. Many studies have been done over the last several decades, and all these studies indicate that human milk is by far better than any other substitute for all infants, but specifically in preterm infants. Preterm infants are at a higher risk for infection or sepsis, and they're at a higher risk for necrotizing enterocolitis. That is an acute inflammation that can happen in the baby's gut and can be fatal. Providing human milk in the NICU as the baby's diet helps protect against that, and it helps with their brain development as well. Because of all the benefits of human milk, the American Academy of Pediatrics has put out a statement that all preterm infants should be supplied human milk in the NICU. The milk that is donated to the milk banks is pasteurized. It's tested for any bacterial or viral illnesses. And throughout the several last decades that we've been using human pasteurized milk, we have had no problems with it.
It definitely made a wonderful difference in mine and Allie's life. Allie was able to gain weight at a much faster rate with the breast milk. The fact that she was able to gain weight because she was so small when she was born at 1 pound 14 ounces and got down to 1 pound 6 ounce, the donor was really helping us in that because I wasn't able to produce that. So that was one of the best milestones for NICU parents, is your baby gaining weight. And the ability to have that breast milk, I definitely, please donate.
I would highly encourage anyone who's interested in donating breast milk to do it. It's a very simple process. It's a great way to give back to the community. Also, when you look at your baby and know that you're nurturing your baby the best way possible, you're also nurturing lots of other babies that are in need.
It really did help us, and both my husband and I and Allie are really thankful. She's doing wonderful. She just had her first birthday yesterday. She's tracking with her corrected age and a little ahead. So she's crawling and she is babbling and trying to say mommy and daddy, so she's doing really well.